With the coronavirus in South Africa, the NICD says there have been challenges in the flow of COVID-19 data in the country. The institute says despite this, it is important to have the correct data on record, although anomalies do not affect patient management. As of Tuesday, South Africa had recorded a total of 3,332,008 positive cases. That's since the start of this pandemic. The majority of new cases are from KwaZulu-Natal, followed by the Western Cape. And as South Africans go on holiday, we're speaking tonight to Professor Adrian Puren, the Acting Executive Director at the NICD, about what we can make of the recent patterns. Prof, always great to have you on the program. So, as things stand, we've been dealing in the last month or so with Omicron officially. Fewer hospitalizations, shorter stays in hospital. Have we made it through the worst?
Well, we've still got a way to go. I know that Gauteng has certainly peaked, but again, we don't know how long that decline in numbers will take place in terms of Gauteng, as well as I think other provinces such as Limpopo, Northwest, and Mpumalanga have certainly also, I think, have probably reached their peaks as well. When we look at the other coastal provinces, in particular Western Cape and KZN and Eastern Cape, there are still certainly sharp inclines in the numbers. But again, when it will reach their peak and the decline is not, one can't really fully predict what will happen over the next few weeks. But certainly, it's great to see that at least for Gauteng, we've reached a peak. So we're not out of the fourth wave. We can't even talk about the fifth wave. But certainly, there are good signs with regard to, for example, severe infections and hospitalizations, certainly up to this particular point, showing again, as you've indicated, that the hospital capacities are not being overwhelmed in terms of bed capacity, oxygen utilization. So I think these are good augurs for what the split wave will actually look like. But let's just be cautious. We're obviously in the midst of the so-called holiday season, where there are going to be people in greater contact, greater mobility. So again, I think we need to re-emphasize the importance of the non-pharmaceutical interventions, the way of mask wearing them properly. Get vaccinated is also one of the key instruments that we really need to encourage people. I know it looks like the holiday season, we shouldn't be doing this, but in fact, I would really like to encourage people to do that, because I think some of the preliminary data that we certainly showed, again, it's certainly preliminary in the sense that it's not linked to the so-called vaccine, electronic vaccine system, certainly shows, again, that not being vaccinated, the outcomes are poorer in terms of severity as well as in terms of death.
And Prof, in terms of this drop in numbers, daily infections, that is, in Gauteng, some of the signs suggest that the province may be past its peak. But I wonder if we could factor in the fact that many people who live and work in Gauteng have, in fact, in the last week and a half, driven to other parts of the country for the holiday. And that's why we're seeing an increase there and a drop here.
I think if we look at, I think we need to look at the levels of testing. If those have certainly declined, it could be, you're quite right, that people are not presenting testing because they've moved elsewhere and hopefully testing elsewhere, or simply that those numbers are an indication that it's the numbers of infected people have actually declined. Because again, if you look at the so-called percentage test positives, in other words, that certainly has declined, and I don't think that's necessarily related to the fact that the actual numbers have certainly declined.
So, Prof, also today in the briefing you said that South Africa's results are for a country with high levels of previous COVID infection, relatively low vaccination levels. How has that contributed to how we fared against Omicron so far? I know we're not through it yet, but how has that helped perhaps, or spared us, shall we say, from too sharp an increase, for example, compared to what you're seeing in the UK?
Yeah, so it's thought that by multiple exposures, as opposed to, let's say, other countries such as Europe or the United States, where, and I know the United States not to the same extent, has highly vaccinated populations, but have had low natural exposures. So it's thought that by having these particular exposures in South Africa, that the immune responses, both the antibody responses and possibly the T-cell responses, have certainly contributed. We know that Omicron certainly is highly evasive in terms of evading the immune responses, at least for the antibody responses. But we do know that the T-cell responses appear to be mainly intact. So it's possible that these exposures to natural infection may well have contributed to what we're currently seeing. In addition to those individuals who have been vaccinated but have also had previous natural infections, there's also a so-called boosting effect. So these particular aspects, again, the boosting may not be to the extent we may like it to be, but certainly that also may well contribute to at least the ensuring that the T-cell responses in terms of severe disease, hospitalizations, and death certainly provides levels of protection.
And Omicron deaths, have we had any confirmed Omicron-related deaths, Prof? Because the likes of the UK have already said they've found one or two.
Yes, I'm sure that, again, we don't always do sequencing on all cases. So I'm sure that there are proportions of individuals who have had Omicron, and it's thought that in those particular settings, again, it's very difficult to know. But certainly when we try and disaggregate what we do have in terms of the numbers, I think there's certainly evidence against at least vaccination certainly being protective. But whether it's specifically about Omicron will be difficult to disentangle. But I think given that Omicron is the most dominant variant within at least Gauteng, that any particular deaths now in this particular stage will probably likely be ascribed to that particular variant. So again, unless you link all the systems together, it sometimes becomes very difficult to pinpoint that, but it's more likely to be the case, yes.
And one of the other issues that have come up from this early research from you is that at the beginning of the Omicron wave, there was concern about an increase in infections among children. That profile has now changed. Is there a scientific explanation for that?
So again, it's not clear what the likely explanations are. It is possible that during the initial phases that in fact there may have been an increase in testing of children out of caution. It may well have been the setting of particular clusters and so forth in terms of incidental findings as well as clusters. So all these particular factors may well have been related to the fact that there was a high level of testing in children. But again, if you look, I think the other key factor that I think I want to emphasize is, you're quite right, the spread is within the general population in different ages. But it would appear again that in the older age groups, in fact, the severity of disease and so forth looks very different. And that's that group that have been vaccinated versus the unvaccinated. So I think that those are key potential, again, really encouraging people to be vaccinated. I know the focus is primarily on adults and above the age of 12. We know that boosters will come along, I hope, fairly soon, but that will certainly contribute. And I think it's going to be really critical at the end to vaccinate children regardless of what we see, whether it becomes endemic or not. Yes.
You've said, Prof, it's too soon to even speak about a fifth wave because we're not through the fourth. And I would also imagine that it's too soon to predict from the fact that Omicron, this latest wave, is more transmissible and less severe. It's too soon to predict that that is what we'll be dealing with future variants. Am I correct?
Yes, absolutely. There's another variant in circulation in South Africa called, I think, C.1.2, for example. And initially, when you looked at the mutations that particular virus held, one would have thought that would become a dominant virus. But you can see that it's more or less leading on to a very low level of transmission. So this virus is continuously evolving. We don't know, and I know that there are thoughts around HIV or patients with HIV or poor immunity that leads to an accumulation of mutations that lead to what we are currently seeing with these particular variants. But again, we can't always predict what will happen, but it's really critical. So although I say we shouldn't be thinking about the fifth, we should be in terms of preparing for and being ready for. In other words, our surveillance systems, in particular the molecular systems, are really key to our understanding. As you know, that twice now that South Africa has identified these particular variants. So I think that having those particular systems will really be critical in informing what possible future events may occur.
What are your thoughts then, Professor Puren, on the recommendation that we've been reading this week in some of the media reporting that the Ministerial Advisory Committee has written to the Health Minister, Joe Phaahla, saying it's time, perhaps, to do away with quarantining of contacts of COVID positive people? Just to explain to people who may have missed it, contacts aren't people who themselves are necessarily ill or have tested positive. How solid is the scientific reasoning on that?
So I don't really want to comment on that because that particular document is still under review, and in fact will go through a review process. But I can use the example of the United Kingdom, for example, where there are discussions, similar discussions to what is happening in South Africa, and it's quite a good example of looking at what are the effects of changing the quarantine regulations. So in the UK, for example, they've certainly reduced that or isolation to about 7 days, for example, but adding antigen testing as well. So I think there are these nuanced approaches that one could certainly adopt, and I think this is probably what the MAC has made those particular recommendations, but I think it's really critical for the National Department of Health and the government ultimately to look fairly carefully in terms of what other effects this may have in terms of changing those particular regulations around quarantine and isolation.
Professor Adrian Puren, NICD Acting Executive Director, always good to speak to you. Thank you for your time tonight.